Hi, I am Dr. Sidharth Verma, and in this video I am going to tell you about a pain clinic. So, what is a pain clinic and who is a spine and pain physician? Who needs a pain clinic? So, a pain clinic is a facility which deals with patients who are suffering with chronic pain. So, by chronic, it means any pain which lasts more than 12 weeks of duration, or any pain which is out of proportion to the injury or the lesion. Who is a spine and pain physician? This doctor is a physician who is trained in managing chronic pain. He can have variable levels of training, and the common denominator is that he is trained to treat chronic pain. The word spine is there because a good number of patients of spine pain visit a pain clinic. So, who needs a pain clinic? Any patient who is suffering from chronic pain which lasts more than 3 months or 12 weeks of duration needs a pain clinic. What conditions are treated? So, these can be orthopedic conditions like elbow pain or shoulder pain or wrist pain or knee pain or spine pain, that is neck and back pain, foot pain, then pain in any part of the body due to the musculoskeletal system. So these are orthopedic conditions. Other conditions include neurological conditions like different neuralgias, nerve related disorders, and also cancer pain. So a pain clinic or a pain physician or a spine and pain physician treats the orthopedic, neurological, and cancer pain conditions which cannot be treated or have not been treated till now in a particular patient. Special emphasis is laid on spine, that is back and neck primarily. So, what is the treatment methodology? So, the treatment methodology includes biological factors, psychological factors, and social factors. So, consideration of all these different factors can help to treat the pain much faster, and it can happen that the pain is cured forever. So, this is the treatment methodology. So, what techniques are used? So, one of the most common technique which is used is the radiofrequency ablation or the cooled radiofrequency ablation. This consists of application of radiofrequency energy to the tissues, thereby heating them up and causing the numbing effect, and hence the pain goes away. This picture shows the cervical facet RFA, that is radiofrequency ablation, and this picture shows the facet joint denervation. So another method is cryoablation, where the cold energy, that is the tissue is frozen, and hence there is an icicle formation around the nerve which initiates Wallerian degeneration and then ensures complete regeneration. So there is no neuritis in these patients. Then the next modality is regenerative medicine, and in this the patient's own blood is taken to make the plasma, and this plasma is then injected into the knee or shoulder or whatever region the patient is having the pain in. Neuromodulation is another exciting field in pain medicine, and this includes implanting multiple electrodes in the spinal cord or spinal canal. So this is applied in the epidural space, and once this goes in, then the patient's pain just goes away. It's just like the pacemaker of the spine, and it's very, very, very effective. Spine endoscopy is a recent development in the last 10 years. Many pain physicians have taken up spine endoscopy and are doing really good job in doing the procedures. So this you can see is the endoscope, the channel, the video camera, and this is the nerve root, which you can see as well. So what I am now going to tell you is about something which brings the patient to a pain physician, and that is obesity. So this shows that the obesity leads to pain, which leads to disability, which again leads to obesity, and this cycle continues. So if you want to overcome this cycle or break this cycle, then there has to be some way. But how to break it? So there are some solutions, and one of them, very important solution, is pain management or pain medicine. And in this, the patient is given the procedure with which the pain is stopped and the patient gets relief from the pain. And key here to note is that you must move and remain active, and hence you can be very healthy. So how do we treat different conditions in spine and pain medicine? So the treatment approach is very much personalized. It is a new branch, that is pain medicine, and it involves minimally invasive procedures like endoscopy, spinal cord stimulation, multiple joint injections or single joint injection, and ultrasound usage in addition to fluoroscopy in some of the procedures. So usually a patient goes from a doctor to doctor in search of pain relief, and many times he gets some conflicting opinions, and then ultimately the patient decides himself what to get treated for. However, in a team approach, there is a pain physician, there is a physical therapist, there is a psychologist, there is a pain yoga consultant, there is a dietitian, and all these people come together to treat the same patient at the same time and result in excellent relief from pain. So the approach is, usually when the patient comes to a pain physician, he's already taking an NSAID or a weak opioid. So the role of the pain physician is to give the intervention, and thereafter he can escalate the dose of the opioids or give advanced interventions again. There is a continuum of restorative therapy, complementary therapy, psychotherapy, and palliative care, which goes hand in hand with all these different approaches. You can consult a pain clinic, which should have ideally online facility, especially in these times because of COVID. So online consultation is a must, and you can do the video consultation through Zoom application, and also in clinic visit is still possible. Okay, so just contact us and feel free to ask anything which you want. Thank you very much.